Welcome, everyone. My name is Indra. Before we commence the forum today, I would like to acknowledge the traditional owners of all the lands on which we gather on today and recognize their continuing connection to land, waters, and culture. We pay our respects to elders past, present, and emerging. These are Aboriginal lands and will always be Aboriginal lands. Today, we will introduce you to integrated living, talk a little bit about the services and value that we provide for our clients. We will also explain what government-funded services are available and how you can access them. And we will conclude with why you should choose us as partners in your journey. Before we get started, I would like to let you know about that the audiences will actually be muted. And please refer to the Q&A chat box on the right hand of your screen if you have any questions along the way. These will be answered at the end of the presentation. A recording of the presentation will be made available on our website after the forums. And you can always contact us directly on our 1300 number at your convenience. So let's get started. On the screen, you have our operational leadership team. Today, you have myself, Indra Arunachalam, the Chief Operating Officer, and Nicole Hudson, our Head of Service Delivery, to take you through the forum. We will now turn off the camera so that we can fully focus on the presentation. We will come back on camera at the end of the presentation. And don't forget, you can pop in any questions on the Q&A chat box. So let me introduce you to Integrated Living Australia. We are a not-for-profit organisation and a registered charity. We recognise diversity, whether in gender, age, language, ethnicity, cultural background, sexual orientation, religious belief, or family responsibilities. We have more than 1,000 staff who are local people who live in the communities we serve. Every year, we provide choice, high quality, and safe services to over 20,000 clients situated across rural, regional, and remote communities. We offer health and wellness options so that clients can live an active life, improve their chronic health conditions, and recover more quickly from hospitalizations and major health incidents. To support our clients and carers through COVID-19, we continue to offer both face-to-face essential services, and we have adopted to online options where possible. At Integrated Living, we are serious about choice and value. We do that by providing a range of quality services to help you live well and safely in your own homes. We provide help at home, which includes personal care, housekeeping, meals, and supported transport services. With our respite and social options, clients stay socially connected and carers can have some time out. This includes social outings, home visits, in-home or cottage respite. Our health services team can help clients stay healthy and manage chronic health conditions. They include allied health services such as podiatry, occupational therapist, diet and nutrition, psychology, and physiotherapy. Our health services team also has nursing services, palliative care, telehealth, short-term restorative care, and dementia care. Our clinicians also run Wellness for Independence programs that focus on early intervention and health management to help clients with their health and well-being. It is a 16-week clinician-led group program where clients learn how to use an iPad, they learn about their chronic health conditions, and what they can do to improve their quality of life. Integrated Living also provides disability support services for people living with a disability. Services include accommodation support, independent living, travel and transport, self and home care, nursing care, community connections, exercise and gym, meals and cooking, as well as carer support. Last but not least, our centres. We are very proud to have established award-winning wellness centres and activity centres. Our wellness centres include state-of-the-art gyms with specialised equipment designed for older people and people living with disabilities. Our activity centres provide a wide array of creative sessions and events to keep people engaged, connected, and have fun. Last year, we won the Aging Asia Elder Care Innovation Award for Best Dementia Care Program, and our 8-year Wellness Introductory Program was a finalist in the Best Rehabilitation Award category. This map shows the regions that we serve. Our focus is supporting communities in rural, regional, and remote Australia. Our clients and staff live in Northern Territory, ACT, Queensland, New South Wales, Victoria, and Tasmania. My colleague Nicole will take you through the various government-funded programs that are available. Over to you, Nicole.
Thanks, Indra. So there are a range of government programs that can be accessed by older persons, those living with disabilities, and veterans in our communities. It can be confusing, so I'll run through this and try and simplify as best as I can. The Commonwealth Home Support Program, known as CHSP, home care packages, known as HCP, and short-term restorative care, known as STRC, are 3 programs that can be accessed via My Aged Care. The National Disability Insurance Scheme is available for those living with disabilities. Both Veterans Home Care and Veterans Community Nursing are available via the Department of Veteran Affairs for those whom are eligible to access at-home support. So let's talk about My Aged Care. My Aged Care is the starting point to access Australian government-funded aged care services. Key programs you can access include CHSP, HCP, short-term restorative care, respite care, as well as aged care homes such as accommodation, care, and hotel-type services. At Integrated Living, our focus is on in-home care, and today we will talk through the options and supports that are available in your home. Like anything, to access services, there are some general eligibility conditions. To access services via My Aged Care, you will need to be 65 years or older, or for Aboriginal or Torres Strait Islander people, 50 years and over. Accessing My Aged Care is simple. You can contact them readily by phone or website anytime. You will speak with a trained assessor who will verify your eligibility and talk with you about your current circumstances, ask further questions, and discuss your needs and goals for future services. From these discussions, the most appropriate services and programs would be identified to suit you, and you will be provided with an aged care referral code. You can then use this referral code to action services with the provider of your choice. For many requiring low-level support, CHSP is a great way to have some help at home. The service is ideal for those that can manage but now require a little bit more assistance and support to keep them living independently and safely at home. Through CHSP, you can access many services via your referral code. However, some key services that are of great value to remain living at home include transport, assisting you to get around in your community from point A to point B, assisting with cooking or meal delivery, such as prepaid meals, or having someone in the home to help prepare cooking and meals, reducing clutter via our crowded house service offering, and also you can access My Support app, which has been developed by Integrated Living Australia, enabling you to manage your services and communicate with us readily. Via CHSP, you can also access a variety of health services, such as podiatry to manage foot pain or concerns that you may have, diet and nutrition services to maintain your health, psychology services aimed at keeping you active and living well, as well as our centre-based services at wellness gyms and activity centres. So let's walk through a CHSP example. Meet Heather. Heather received her aged care referral code for services such as domestic assistance, transport, and allied health. Heather calls Integrated Living to put her services in motion. An admissions officer speaks with her to develop a service plan for the domestic and transport assistance. A qualified and experienced support worker will come to the home to provide the domestic services for Heather on an ongoing basis, and vouchers will be provided for Heather to use for future transport needs. An exercise physiologist will undertake an assessment with Heather to develop an exercise plan unique for her. It's important to remember that all services that are in place for Heather are reviewed regularly with her, and should Heather have any changes to her health or care needs, further services could be added to support her as required. It's also important to note that a co-contribution to the cost of services may also apply in some instances. I'll now pass you back through to Indra. Thanks, Indra.
Thanks, Nicole. We've just seen that Heather attends the gym classes at one of our wellness centre. Our wellness centre programs are tailored to improve strength, balance, mobility, and confidence, as well as relaxation and socialization. The gyms are specially built so that clients can enjoy gentle exercises supported by our team of qualified exercise physiologists and personal trainers. In addition to the wellness centres, we have activity centres. Our activity centres provide a wide array of creative and fun activities to keep clients engaged and connected. Activity centres are also there to support carers have a break. The activity and wellness teams offer both centre-based and virtual programs. The main goal of these wellness and activity programs are to help both clients and carers stay independently at home for longer. This map shows where all our centre-based services are located. And as I mentioned earlier, we also offer a suite of online or virtual programs which can be accessed from anywhere. And these are our Wellness for Independence group programs, our wellness exercise programs, and our activity programs. So now let's talk about some higher level care needs and specifically home care packages. Home care packages, or HCP, provide a package of services to meet clients' care needs that go beyond what CHSP can provide. If you have greater or more complex care needs, you could be eligible for a home care package. There are 4 levels based on the level of care needs, from basic assistance through to high needs. Level 1 is for older people with basic care needs, and the package comes with an annual funding of approximately $9,000. Level 2 is for people with low-level care needs, and the package comes with an annual funding of over $15,000. Level 3 is for people with intermediate care needs, and the package comes with an annual funding of over $34,000. Level 4 is for people with high-level care needs, and the package comes with an annual funding of approximately $52,000. Clients contribute to the cost of care if they can afford it. There are 3 types of fees under the home care package. Firstly, basic daily care fees. At Integrated Living, we waive these basic daily care fees. Secondly, There's income-tested care fees. These are determined by Services Australia or Centrelink, and they are based on the client's income levels. And then there is additional fee for any extra services that are not covered by the package, as there are strict guidelines on what the HCP can be spent on. One of the biggest difference between a CHSP and a HCP is the case management. Your home care package comes with a dedicated integrated living case manager who will bring a personalized and holistic approach to how we support clients in their own home and community. The case manager will sit with the client and their significant family member or partner and talk about their unique needs and goals, and they will co-design an individualized care plan that maximizes the package. The case manager will engage with our multidisciplinary team of registered nurses and allied health professionals, including wellness and activity teams, to ensure we embed an early intervention, wellness, and reablement focus in our care and service delivery. Together with the client and their family, we will monitor and review the services to help the client stay well and safe in their own home. As we've mentioned, integrated living provides a range of services. For home care package, we can group them into help at home and health services. Some examples of help at home are personal care, where we can help the client with personal hygiene, grooming, and other personal care needs, and medication support for safe and effective medication. Some of the health services available through the home care package are nursing services for managing chronic illness and general health challenges, dementia care to support people living with dementia and their carers, holistic palliative care for people living with a life-limiting illness. So let me introduce you to Graeme from Ballina. Graeme received an aged care referral code for a level 4 HCP. He contacts Integrated Living to put his package in motion. A case manager will visit Graeme to assess his needs and develop a goals-based care plan. Graeme will also be visited by the health services team to assess his health needs and develop a health care plan. Based on Graeme's care plans, a support worker will visit him with personal services to help him with his personal care, as well as cleaning and household tasks. An occupational therapist will assess Graeme's home to develop and implement a plan for some home modifications so that Graeme can be safe and independent at home. If Graeme has any questions or would like to review his care plan, he can contact his case manager. For example, if Graeme had a skin tear and needed a nurse to do some wound care, his case manager can arrange that from his home care package. Graeme can also choose to use his home care package funds to pay for his wellness gym classes or wellness for independence group programs. Basically, Graeme has choices, and his case manager can help Graeme explore and maximize his home care package. I will now hand you back to Nicole.
Thank you. So, what is short-term restorative care? STRC is a time-limited program of 8 weeks. During the 8 weeks, intensive care and support services are available, and the aim of the program is to help you slow or reverse the difficulties you are experiencing with everyday tasks. Under this program, you would be supported by a team of health professionals that will help you to manage or adapt to your changing needs. In accessing this program, it's important to note that you are expected to contribute to the cost of care if you can afford to do so, and that currently stands at around $10.54 per day. Under the STRC program, there are some great services available, and some highlights for many are home modifications, whereby small changes around the home that can help you to stay living safely and comfortably can be organised. Aids and sensors can be made available, helping you to stay safe in your home and community. And home upkeep, just general services to keep your home well maintained. Through the STRC program, there are some terrific health services also available. And again, some of these highlights are occupational therapy, supporting you through the activities of daily living, telehealth, medical monitoring supported by technology, physiotherapy, advice and support to keep you active and injury-free. We also have centre-based services such as our wellness gyms and activity centres that can also form part of your program. So let's meet Neil, 68 years old, from Launceston. Neil receives his aged care referral code for STRC. He contacts Integrated Living to put his STRC in motion. A senior health coach visits Neil to access and develop a goals-based care plan in consultation with his GP. A registered nurse provides wound care post-hospital discharge. An OT will assess, develop and implement an allied health care plan with Neil for any home modifications. An exercise physiologist will assess and develop a goals-based exercise plan with Neil for virtual gym classes. And Neil's care plan is reviewed at 4 and 8 weeks with him. Neil will either be discharged from STRC or referred to My Aged Care for other services to support him at home at the end of the 8 weeks. And remember, Neil will contribute to the cost of services if he can afford to do so. Back to you, Indra.
Thanks, Nicole. Now, if you are not eligible for My Aged Care and require support, there are other options based on your situation. The National Disability Insurance Scheme, or NDIS, provides Australians aged 65 years and under who have a permanent and significant disability with funding for supports and services. Support and services may include social participation, independent living arrangements, and health and wellbeing services. The NDIS provides opportunities to live independently, learn, work, or be more involved in community. How can one access the NDIS? You start by lodging an access request, and this can be through your local area coordinator, over the phone, or on the NDIS website. The National Disability Insurance Agency, the NDIA, will conduct an assessment with the client, and where the client then provides evidence of their disability. The NDIA will make an access decision where they decide if the client is eligible for NDIS funding. They will then organize a meeting with the client to discuss their support requirements and funding. The NDIA will develop an NDIS plan based on the client's functional capacity, support needs, and goals. Once the client has their approved NDIS plan, they can shop around for a service provider. And how can Integrated Living help this client? You can call us to consult our specialist disability support team to discuss the NDIS plan and view our range of support services. And the support services include independent living, transport, self and home care, nursing and allied health therapy, exercise and gym, community connections, respite, and carer support. If you are a veteran, the DVA or Department of Veterans Affairs can help you. DVA provides a variety of in-home and community support programs focused on assisting people to continue living independently by supporting their health, well-being, and community connection. DVA clients who have a gold card or white card are eligible to access veterans home care and community nursing programs. Let's start with how veterans can access Veterans Home Care or VHC services. You contact the VHC agency. An over-the-phone assessment is conducted and a VHC care plan is developed with you. The VHC plan is sent to you and your service provider. When your service provider receives the care plan, they will call you to put your care plan in motion. The types of services that you can access under VHC are domestic help, personal care, respite care, and safety-related home and garden maintenance. You will be asked to make a co-contribution towards the cost of providing VHC services. Now let's look at how veterans can access community nursing. Your GP, hospital discharge planner, or VHC assessment agency, can make a referral for DVA community nursing. DVA will contact the service provider, who in turn will organize for a registered nurse to contact you to confirm eligibility and assess your care needs. Together with you, the nurse will develop a community nursing care plan and implement it. How can integrated living help you or the client? Our nurse can assess your eligibility, care needs, and develop your community care plan. Our health services team and service delivery team can help you with medication, wound care, hygiene, showering, and dressing. There is no co-payment for DVA community nursing. So why choose integrated living as your partner or service provider? We are a team of passionate professionals who are committed to delivering customized and integrated services that support individuals in their community. Our emphasis is on safe and dependable service delivery. We have highly qualified clinicians, which include registered nurses and allied health professionals, to provide clinical pathways and support for our clients and carers. We support our clients to use technology to improve communication and improve access to services. We have wellness and activity programs that are both center-based and virtual. We have award-winning programs that are recognized both nationally and internationally. Our focus is rural, regional, and remote Australia. We are local people who understand our local communities. We want to make sure that people in the bush have equal access to high-quality services. We are a not-for-profit organization that reinvests in delivering better health and well-being outcomes for people living in community. As our tagline says, we're all about supporting individuals and enriching communities. So we're just turning back the camera on now. So Nicole and I would like to thank you for this opportunity to present our team and our services to you today. And I believe we do have one question: does this service cost? So I'll quickly just recap. We talked about several different types of services. We talked about the My Aged Care services. We started off with Commonwealth Home Support, or CHSP. And yes, there is a contribution to that if you can afford to. And then we talked about home care packages. Home care packages, as I said, there are 3 types of fees that you can pay. One is the basic daily care fee. At Integrated Living, we waive that fee, so you don't have to pay the basic daily care fee. The second fee under a home care package is income tested fee, and that is assessed by Services Australia or Centrelink, and it is dependent on your level of income. So that's outside of Integrated Living's control. And the third is any additional fees for any extra services that you want, which is outside of what is within the package guidelines. So for home care packages, if you do not have any income tested fee and your services are within the package, you actually do not have any fees to pay. It'll be fully funded by the package. And then we talked about short-term restorative care. And under short-term restorative care, yes, there is a daily fee of about $10.50, but again, we will only charge you that if you can afford it. And then we talked about NDIS. With NDIS, that's part of the NDIS package. So whatever services that are funded, all of that funding comes from your package. And then lastly, we talked about DVA services. We talked about veterans home care. Yes, there is a small co-payment with that as stipulated by veterans. And then we talked about DVA nursing, community nursing, and the DVA community nursing does not have any co-payment in that. I hope that answers that particular question. Does anybody else have any other question? Well, if that is all, before Nicole and I finish for today, I would like to remind you that you can contact our customer service center on the 1300 782 896 number or visit our website. Nicole and I thank you and wish you a lovely evening.
Thank you. Bye-bye.